Healthcare was in focus at this year's World Economic Forum China discussions. The revenue split between emerging markets and the developed economies for Phillips Health Care is 75% for developed nations, 24% for emerging markets. Samantha Loring caught up with Deborah DiSanzo, Phillips Health Care CEO, on what Phillips's healthcare strategy is to increase their share from developing economies.
You know, a few years ago, the growth in developed markets was not very strong, and now I think last year we added 2 points to that growth, so 22% to 24%, and we see it growing very rapidly. The beautiful thing is now all economies around the world are talking about how do we get access to healthcare and how do we provide healthcare to parts of the world that never had it before. So we're having discussions with countries all over the world of really how do we increase access, and that, of course, grows the business for Phillips and other countries as well.
Yeah, I suppose one of the key words that we're all talking about at this WEF is innovation and what it means to companies like yourself. So one of the ideas around that is how to take healthcare to rural areas, because that's specifically a problem if you're looking at the African economies. What is your unique approach to the kind of solutions we could look at in Africa?
Samantha, you just said it. We have to bring healthcare to the rural areas. So let me talk about two maybe. In Uganda, we have this very unique program with Imaging the World, a not-for-profit organization that really, working with our low-cost ultrasound machines, takes the technology out to the remotest parts of Uganda and does imaging on women who are pregnant in the late stages of the pregnancy. Through a simple mobile phone technology, take the image, send it over a mobile phone to a physician in Kampala or somewhere that they can read the image and then say, yes, you know, this woman needs help, we should get her the health care she needs, or she's fine. So this is, you know, using mobile technology to take the health care out to the rural areas and get the information back to a doctor who can help.
So what are your thoughts right now in terms of Africa's approach to rolling out universal access to healthcare? And I suppose talking Africa in general is a big generalization, but I suppose one of the criticisms is the focus on big public infrastructure and the need for, you know, public hospitals. Do you see that approach as, you know, the right one? I mean, what are your thoughts in terms of the kind of road we're going down in Africa?
You know, actually at WEF we have a working group going on now which is talking about how do we leapfrog past in new healthcare systems to right to value? How do we provide better value at a lower cost? We can think that developed economies built up their cost infrastructure in healthcare. And what we want to do in countries such as Nigeria, really think about how can we do rapid prototyping to get to value quicker. This could be in mobile health. It could be in taking mobile vans with diagnostic products out to the most rural areas and providing the care there. We have to think differently. We have to think innovatively. And we really need to think about partnerships between private companies, the public sector, and the government sector to create these solutions that are going to leapfrog and really go right to value instead of to a buildup of cost.